Which of the following drugs is classified as a Schedule II controlled substance? A. Alprazolam. B. Hydrocodone. C. Tramadol. D. Diazepam. Answer B. Hydrocodone is classified as a Schedule II controlled substance due to its high potential for abuse and dependence. Alprazolam and diazepam are Schedule IV, and tramadol is Schedule IV as well. What is the beyond use date, BUD, for a non-sterile compound containing water, stored at controlled room temperature? A. 3 days. B. 7 days. C. 14 days. D. 30 days. Answer C. According to USP 795, non-sterile water-containing oral preparations have a BUD of 14 days when stored at controlled cold temperatures unless stability data states otherwise. Which DA form is used to report the theft or loss of controlled substances? A. DA Form 222. B. DA Form 41. C. DA Form 106. D. DA Form 224. Answer C. DA Form 106 is used to report theft or significant loss of controlled substances. Form 222 is for ordering Schedule II drugs, Form 41 for disposal, and 224 for registration. How many refills are allowed on a Schedule IIIV prescription under federal law? A. None. B. Up to 3 times. C. Up to 5 times within 6 months. D. Unlimited within 12 months. Answer C. Federal law allows up to 5 refills for Schedule IIIV controlled substances within a 6-month period from the date of issue. What is the correct concentration of sodium chloride in normal saline for bags? A. 0.9%. B. 1%. C. 5%. D. 10%. Answer A. Normal saline contains 0.9% sodium chloride. It is isotonic with body fluids and commonly used for hydration and dilution. Which drug classification does lisinopril belong to? A. Beta blocker. B. ACE inhibitor. C. Calcium channel blocker. D. Diuretic. Answer B. Lisinopril is an ACE inhibitor used to treat hypertension and heart failure by preventing the conversion of angiotensin I to angiotensin II. What is the maximum number of tablets that can be dispensed for a C2 prescription with no refills? A. 30. B. 60. C. 90. D. There is no federal limit. Answer D. Federally, there is no specific limit to the quantity of Schedule II drugs that can be dispensed, but states or insurers may impose limitations. A patient brings in a prescription for amoxicillin 250 mg per 5 ml, dispense 150 ml. How many mg of amoxicillin will the patient receive in total? A. 750 mg. B. 1000 mg. C. 3750 mg. D. 5000 mg. Answer C. Each 5 milliliters contains 250 milligrams. For 150 milliliters, 150 divided by 5 equals 30 doses times 250 milligrams equals 7,500 milligrams. Which auxiliary label is appropriate for metronidazole? A. May cause drowsiness. B. Take with food. C. Do not drink alcohol. D. Avoid sunlight. Answer C. Metronidazole can cause severe disulfiram-like reactions when taken with alcohol. Patients should avoid alcohol during and 3 days after therapy. Which organization assigns NDC numbers to medications? A. FDA. B. DEA. C. USP. D. CDC. Answer A. The FDA assigns National Drug Code (NDC) numbers, which uniquely identify drug products. Which of the following must be included on a unit dose label? A. Patient name. B. NPI number. C. Drug name and strength. D. Pharmacy phone number. Answer C. Unit dose packaging must include the drug name, strength, expiration date, and lot number, not patient-specific data. What does the DA code 1 mean? A. No product substitution allowed by prescriber. B. Generic allowed. C. Patient-requested brand. D. Pharmacist chose brand. Answer A. DA 1 means dispense as written, the prescriber has requested the brand name drug only, no substitution. Which law required child-resistant containers for most prescription drugs? A. HIPAA. B. FDCA. C. Poison Prevention Packaging Act. D. Controlled Substances Act. Answer C. The Poison Prevention Packaging Act mandates child-resistant packaging for most prescription and OTC medications to prevent accidental poisoning. Which medication is considered a high-alert medication? A. Omeprazole. B. Warfarin. C. Cetirizine. D. Acetaminophen. Answer B. Warfarin is a high-alert drug due to its narrow therapeutic index and risk of severe bleeding. A prescription is written for levothyroxine 0.075 mg. How many micrograms is this? A. 7.5 micrograms. B. 75 micrograms. C. 750 micrograms. D. 7,500 micrograms. Answer B. 1 milligram equals 1,000 micrograms. So, 0.075 milligrams equals 75 micrograms. What is the purpose of a laminar airflow hood? A. To filter liquids. B. To protect staff from spills. C. To create a sterile environment for preparation. D. To store hazardous waste. Answer C. A laminar airflow hood is used to create a sterile field for preparing medications by filtering air through HEPA filters. Which schedule of drugs requires a DEA Form 222 to order? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer B. DEA Form 222 is required for ordering Schedule 2 controlled substances. Schedule 3V drugs do not require this form. Which USP chapter covers sterile compounding guidelines? A. 795. B. 797. C. 800. D. 1160. Answer B. USP 797 outlines standards for sterile compounding practices to ensure patient safety and product integrity. Which of the following medications must be dispensed with a med guide? A. Ibuprofen. B. Metformin. C. Isotretinoin. D. Furosemide. Answer C. Isotretinoin requires a med guide due to its teratogenic risks and is regulated under the iPledge program. A bottle of metoprolol has an expiration date of May 2025. When does it officially expire? A. May 1st, 2025. B. May 15th, 2025. C. May 31st, 2025. D. June 1st, 2025. Answer C. If only the month and year are listed, the medication expires on the last day of that month, i.e., May 31st, 2025. Which of the following drugs requires REMS, risk evaluation and mitigation strategy, monitoring? A. Levothyroxine. B. Clozapine. C. Simvastatin. D. Loratadine. Answer, B. Clozapine requires REMS monitoring due to its risk of severe neutropenia. Regular ANC, absolute neutrophil count, monitoring is mandated to ensure patient safety. A prescription is written for furosemide 20 mg PQD. What does PQD mean? A. Inject once a day. B. Take by mouth every other day. C. Take by mouth once a day. D. Take twice a day. Answer, C. P stands for per os, by mouth, and QD means once daily. So, the instruction is to take the medication orally once a day. Which of the following is classified as an antiplatelet medication? A. Warfarin. B. Clopidogrel. C. Enoxaparin. D. Apixaban. Answer, B. Clopidogrel is an antiplatelet drug used to prevent blood clots. Warfarin and apixaban are anticoagulants, and enoxaparin is a low molecular weight heparin. What is the correct temperature range for refrigerated medications? A. 15 to 25 degrees Celsius. B. 2 to 8 degrees Celsius. C. 8 to 15 degrees Celsius. D. -10 to 0 degrees Celsius. Answer, B. Refrigerated medications should be stored at 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit, to maintain stability and efficacy. The Red Book is primarily used for information related to A. Drug interactions. B. Therapeutic equivalence. C. Drug pricing and availability. D. Drug side effects. Answer, C. The Red Book provides information about drug pricing, NDC numbers, and product availability. It is a vital resource for pharmacy technicians managing inventory. Which law requires healthcare providers to protect patient privacy and health information? A. OBRA 90. B. CSA. C. HIPAA. D. FDA Act. Answer, C. HIPAA, Health Insurance Portability and Accountability Act, mandates confidentiality and security of healthcare information. What does a medication's therapeutic index indicate? A. Expiration date range. B. Dose required to be effective. C. Ratio of toxic dose to effective dose. D. Frequency of side effects. Answer, C. The therapeutic index compares the toxic dose to the effective dose. A narrow index means there's a small margin between safety and toxicity. Which of the following dosage forms bypasses first-pass metabolism? A. Oral tablets. B. Sublingual tablets. C. Capsules. D. Suspensions. Answer, B. Sublingual administration allows the drug to absorb directly into the bloodstream, bypassing liver metabolism, leading to faster action. Which organization accredits pharmacy education programs in the U.S.? A. FDA. B. ASHP. C. NABP. D. ACPE. Answer, D. The Accreditation Council for Pharmacy Education, ACP, is responsible for accrediting pharmacy technician and pharmacist education programs. A pharmacy technician receives a prescription for insulin glargine. What should they avoid when processing it? A. Shaking the vial. B. Refrigerating before use. C. Labeling with expiration date. D. Dispensing in a pen. Answer, A. Insulin should never be shaken as it can denature the protein and reduce its effectiveness. It should be gently rolled if needed. Which part of the NDC number identifies the drug itself? Strength, dosage form, formulation? A. First segment. B. Second segment. C. Third segment. D. Entire number. Answer, B. The second segment of the NDC number identifies the specific product, including strength, dosage form, and formulation. Which of the following is an example of a look-alike/sound-alike LASA medication pair? A. Metoprolol and atorvastatin. B. Lamisil and Lamictal. C. Omeprazole and pantoprazole. D. Amoxicillin and azithromycin. Answer, B. Lamisil, antifungal, and Lamictal, anti-seizure, are LASA drugs. Confusion between these can lead to significant medication errors. Which of the following drugs requires regular INR monitoring? A. Enoxaparin. B. Warfarin. C. Apixaban. D. Dabigatran. Answer, B. Warfarin's anticoagulant effect varies between individuals, so INR, International Normalized Ratio, must be monitored to ensure therapeutic dosing. Which abbreviation indicates a medication should be taken at bedtime? A. QD. B. HS. C. BID. D. AC. Answer, B. HS stands for orasomni, meaning at bedtime. It is commonly used for sedatives or other nighttime medications. What is the maximum allowable amount of pseudoephedrine that can be sold to a patient in one day, per federal law? A. 2.4 grams. B. 3.6 grams. C. 5.0 grams. D. 7.5 grams. Answer, B. Under the Combat Methamphetamine Epidemic Act, the daily sales limit for pseudoephedrine is 3.6 grams per individual.